I'm Dr. James Markham, and welcome to Heart of Health. I'm glad you took your time today because we're going to talk about a very interesting and important subject to each one of us, and that being our teeth. You know, smiles are very important to all of us because it's the way we relate to the world. Everyone wants a good, happy smile. Did you know that when you smile at a person and make them feel happy, you can change their chemistry? You actually can increase their endorphins. So just by having a happy smile, you can change the chemistry of the world. What a neat thought. Today, as our special guest, we have Dr. Phillip Swords. He is a practicing dentist in the Atlanta area. And Dr. Swords, we are so glad you're here visiting with us on the Heart of Health and going to teach us all sorts of neat things about our teeth. But before we get started, tell us a little bit about your journey. How did you end up being professional a dentist?
Well, when I was a kid, Jim, I actually enjoyed doing work on small things. And I truly am someone that believes that God gives you a calling, and that if you can listen to God, you can find what you're supposed to do with your life. And as time went on, different things happened. My father actually told me if he could do it all over again, he would be a dentist.
Okay.
And just different things like that. And as time went on, I loved science, and I loved helping people, and I liked working with small things. So all those things kind of came together, and dentistry has just been the perfect thing for me. I really enjoy it.
Now, did you go to dental school here in the South, or?
I did.
Okay.
I went to dental school at the Medical University of South Carolina in Charleston.
Mm-hmm.
And really, another God story. There was another school that actually had me accepted. They lost my letter of acceptance. I was also accepted at Emory. Emory closed their dental school 17 days after I was accepted. And I ended up at the Medical University of South Carolina and learned a lot of the things there that I might not have learned at other schools. Just happened that way.
Now, the training for a dentist, how many years is that?
You go to school for 4 years usually to get a degree, a BS, and then after that 4 more years to become a dentist. You go to dental school, dental college somewhere, and then after that some people do residency programs, some people don't. Many people just go out and start practicing. That's what I did.
Now, how did you end up where you're at? Was it a family thing, or did you grow up there, or does someone invite you to come and join and practice?
Well, I actually, we moved to Coweta County. My dad was from North Alabama, and my mother, and they wanted me to live out in the country. And so we moved to the Atlanta area. My dad traveled up and down the East Coast. He was actually a bakery scientist. And we moved out in the country in Coweta County, Noonan, Georgia. And I went to dental school in South Carolina and planned on practicing in South Carolina because that's where I was. And I kept thinking, golly, you know, I just missed something about Noonan, Georgia. So ended up going back to Noonan, Georgia, and it's just been really a lot of fun.
And patients, you still see patients every day?
Every day
in Noonan, Georgia?
Every day, yes.
Well, that's fantastic. Now, how long have you been there practicing now?
21 years.
21 years. So everyone sort of knows where they can get their teeth looked at in
That's
Noonan,
right.
Georgia.
That's right.
That's great. Well, what we've done, Dr. Swords, is we've collected questions from the HeartWise Ministry website, and we're going to answer them today because our guests, not our guests, but our visitors that come to our website are very interested in dental care, oral hygiene. And our first question is, this is a great one. It actually comes from the state you were at, South Carolina. It says, why should I go to the dentist? My mouth feels fine and my teeth look good.
Right.
So why should we go to the dentist?
Well, a lot of what you're talking about and some of what we've discussed, just you and I personally, when you go to the dentist, they can clean your teeth better than you can clean them at home. And you're looking to get 3 millimeters below your gum line. And we can't do that at our house, really. It's virtually impossible for us to do that. Also, when you do that, your body sends antibodies straight specific for your bacteria and kills the bacteria in your body in those sites, which decreases inflammatory processes in those areas. And so, you know, it's just healthy for you. That's what you need to do.
So you're telling us we can't clean our teeth as well as a dentist can clean them?
That's correct. Or a hygienist. I should make sure I say hygienist also,
okay.
Yes.
Well, that's great. Well, we're about ready to go to break right now, but when we come back, we have a question that deals with our gums. So we'll be back in just a minute. Please stay with us on Heart of Health. I'm Dr. James Markham, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
You can easily spend $90 on an expensive meal out. How about investing $89.94 in your future? Just think about the possibility of coming off those prescription pills and getting rid of all the side effects. Think about feeling better than you have ever felt in your life. This is all possible for you. For only $89.94, you will receive a 7-part DVD series, Weight Management by the Book, a 30-lesson workbook with over 100 recipes, and if ordered today, exercise tubes will be included for free to help with your journey. There are many programs available, but this unique program has identified the truth about how to manage weight. This program is not available in stores. This limited offer will not last long. Pick up the phone now and dial 877-504-9628. Operators are standing by. This call will change your life forever.
Welcome back to Heart of Health. I'm Dr. James Markham, and our special guest today is Dr. Phillip Swords, and we're talking about smiles and teeth. And our next question, Dr. Swords, comes in from a person that has a gum line problem. She says, is a receding gum line something to worry about, and is there something that can be done to prevent this? So I guess this is a question about keeping the health of the teeth and the gums clean.
Well, it's important, a couple things. Here are some toothbrushes, and you'll notice up in the top hand corner it says medium. Someone asked me recently what these are good for, and I said cleaning the toilet. So never use a medium toothbrush. Always use something that says soft. So we always want to have soft on here.
Now you mean the bristles being soft?
That's correct.
Okay.
And one of the reasons is you don't want to actually brush your gums away. So that's an important thing. You don't want to have a sawing motion. You don't want to be sawing.
So you're telling me I can actually brush my gums away?
Yes.
Oh, wow.
Yes, so we don't want to do that. That's
No.
one thing that we don't want to do. But we want to clean them well enough. So if you're starting to have hand problems, you want to have something that's ergonomic so that you can hold on to it that's big enough. Okay. You'll even notice that, look at this handle versus these handles.
Okay.
So we want to be able to clean what we can off our gums to make sure we're doing that. Also, you have irrigators now. And interesting enough, we can't tell someone that they can use a water pick product or an irrigator versus flossing. But you notice they have now termed it the water flosser. And they're trying to make sure that maybe if you don't floss that you use this. What I can tell you is this decreases the inflammatory processes around your gums. It's a real clean product. It's great. Obviously, floss is a great thing to keep. You want to keep your gums healthy, because what happens is when they become inflamed, you'll end up with a situation where you'll have osteoclast. They'll start killing the bone around your teeth, and then your gums will shrink.
So osteoclast, what's that mean?
Osteoclasts are just cells in your bone that are trying to really get rid of bacterial inflammatory areas. And so in the process, they actually start taking the bone away.
Ooh.
Right.
So you're telling us if we don't keep our teeth and gum clean, we sort of have a low-level disease state in our mouth?
Yes.
Ooh.
And so we want to decrease all of the bacteria that we can in there, the bad bacteria is what we'll say. Even things like tongue cleaners. We're even talking about cleaning our tongues. So there's a tongue cleaner. Even in this product right here, Colgate's Total, they're talking about how there's something on there that actually kills the bacteria on your teeth for up to 12 hours. That's their big focus, is decreasing gingivitis. We also have things that are go-betweens, is what we call them. Something to go between your teeth that'll clean that space between your teeth, which we call an embrasure. And you want to clean all surfaces of your teeth, all the way around it.
So answering this questions, the receding gum line and keeping the teeth clean is something to worry about.
Absolutely, yes.
Because it could be a source of all sorts of problems. You know, we've heard about heart disease and gum disease and inflammation. Could you mention to our audience a little bit about that connection?
Well, what they've shown is that the bacteria from your mouth is going to the plaque in your heart. They did a tracer protein study where they showed it was specifically going from the mouth to the heart. And we know that's there. We also know that there's an inflammatory process that's involved with this. Many scientists now are talking about aging is actually is an inflammatory process. So what we're trying to do is decrease your inflammation around your gums, which is one of the top places for inflammation in your body.
Yeah, and once inflammation gets on our gums, it gets in the bloodstream, it travels throughout.
That's correct.
Well, you don't ever think about one of the causes of heart attacks is inflammation in the mouth.
That's right.
You know, we talk a lot about on Heart of Health about stresses on our life. Now, I'm curious. You know, we have all these neat products here to help keep our mouths clean. When we get back from break, we're going to talk about why we need all these products and why our ancestors hundreds of years ago didn't have all this, and did they do okay or not as far as heart disease and gum disease?
I think they were better than us.
Well, when we get back from break, we're going to talk to Dr. Swords about why our mouths, why our gums are in need of all this equipment to keep them healthy. We'll be right back after this short break. There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance. When to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing? Welcome back to Heart of Health. Today we're talking about the importance of taking good care of your mouth and your teeth with Dr. Phillip Swords. And Dr. Swords, we've talked already about all the neat ways we can keep our teeth and gums clean. And I'm just thinking about 200 years ago, we didn't have that many dentists, we didn't have that many products. What's happened that we need to fight inflammation and that all this disease starts in our mouth? Why do we need these products?
Well, you have things like sodas that have a lot of acids in them and a lot of sugars, and we're bathing our teeth with them. And then we're taking drugs like antidepressants, and they're decreasing our salivary flow. Most all drugs, and that's a big general statement, so I don't want to, they're decrease your salivary flow. And so
so when we say salivary, that's the moisture in the mouth.
Moisture in your mouth, your spit, for lack of a better term, it's your spit. And we have products that make your mouth salivate more, which have sugar in them. But the problem with that is then you're starting to talk about decay. You're giving sugar for those bacteria that are bad in your mouth. And so and now we're starting to have products, it's ironic, that are helping us get rid of them. This one I noticed today has natural germ killing.
Oh yeah, we want that, don't we?
Well, I think so. Okay. But basically this pulls the stuff off your teeth. I mean, so it's not like there's a chemical in here doing this. It's actually just the gum pulling the bacteria off your teeth. Okay. So, and it works great. Ironically, we went to Honduras and did a mission trip, and one of the first things that I figured out was to get as much of that stuff off their teeth, the plaque and stuff. I gave each one of them sugarless gum. Oh. So sugarless gum's a great thing.
So in your office with your hygienist, you should get them to chew some gum.
There you go.
You won't have to work as hard.
That's right. Okay. That's right. Also, mints that don't have sugar in them will increase your salivary flow, but they won't have the negative of the sugar. So that's an important thing. And things like these sticky Skittles and these sticky Starburst, these stay on your teeth. and they're really, really rough on your teeth. So, we didn't have those things 200 years ago. Also, even tobacco, maybe they were chewing tobacco leaves, but the tobacco didn't have fiberglass in it. And the fiberglass, what it does, it's supposed to hit your tissue and cause a quicker release of the nicotine into your body so that you get an effect. But what it also does, it wears your teeth down.
So you're telling me that nicotine has fiberglass in it, so it... No?
Not nicotine.
Okay.
Smokeless tobacco,
Okay.
a lot of products have fiberglass in them. And so then the fiberglass wears your teeth down, and you'll decay because now you don't have the enamel on your teeth. And also, obviously, it causes, oral cancer, which we're aware of.
Yeah.
Also causes a really bad inflammatory process of your tissue. But once again, that's planned because it's supposed to prickle your tissue and send that effect to you faster.
Wow. This is, I didn't realize all this is going on in my mouth all the time.
Right.
So we can help our listeners and our viewers lower the chance of having a heart attack just by taking good care of their teeth in inflammation.
Yes, I believe that.
Now, another question here is, I guess we're better off drinking water and staying hydrated than we
Right.
are drinking all sorts of everything else.
Exactly. You want to drink more of this and less of this.
Okay.
That's basically what it is. And also, sipping a product like this is terrible. One of my patients is a mail handler. And so he would put a soda in, and every time he got in and out, he would take a sip. Decay, just rampant decay.
And
you just
feeds this
Right.
process.
swap it with water, now you're helping your teeth.
Yeah.
This one hurts it, this one helps it.
Now, how can I tell myself if I have this inflammation, all this bacteria going on in my mouth? How do I know when I'm doing a good job of fighting this?
Well, you can do things like use a plaque stainer, but really a simple way is, how bad is your breath?
Oh, okay.
And how bad do your gums bleed when you brush and when you floss? And if when you brush and floss your gums bleed, then you're not getting it out. Also, if you have bad breath, there's a source for that.
Okay.
And it's almost always bacterial. Now, so if it's not in your teeth, it's somewhere else. It's in your sinuses, it's in your tonsils, it's someplace.
Now, we talked about going and having your teeth cleaned by someone that could really get down there and do that. How often should that be done?
Most people, twice a year.
Okay.
There are certain people that have more problems, they have to do it more often. So I have one patient that he realized how much it helped him. We cleaned his teeth every month.
Wow.
Not many people connect to that.
And can go in every day.
Right.
And I guess,
or afford it.
and from a cardiologist's point of view, you don't think about it, but you're lowering the chance of infections that get into blood from the mouth, and
Right.
also the inflammation, which triggers these plaque ruptures. Well, that's great. The next question we're going to come back to after break has to do with someone that's very scared of the dentist. And I'm sure you never have that. But this person's scared of the dentist and wants to know something about sedation and the
Okay.
safety of that.
Great.
So we're going to come back with Dr. Phil Swords right after this short break. I'm Dr. James Markham, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org. Welcome back to Heart of Health. We're talking with Dr. Phillip Swords, who specializes in dentistry, mouth care. We're answering some questions, and this is a very great question. I'm sure a lot of our viewers have this, Dr. Swords. They write, I'm scared of the dentist. And I guess I would fall into that category too. I'm not scared of you, but when I'm sitting in the chair, I get scared. It says, I heard a commercial about sedation. Is this a good idea?
I think sedation is a great idea. I think that anything, well, I say anything, whatever we can do to get you to the dentist, I think it's important. I think that we use the word sedation also, and analgesia a lot of times is a word we use in dentistry. It's where you're not sedated to the point sedation is you don't know you're out.
Okay.
Your heart's still beating, you're still breathing, but you're not aware of anything around you is what I would term sedation. Analgesia is where you're just kind of happy.
Oh, okay.
You know, things are going on around you. It's kind of like I tell people, we're going to give you a shot, but you just don't care.
Okay.
And that's kind of the way it is with what I'll call analgesia. There's really two ways you can give analgesia. One is an oral form of a drug, something like Xanax or Valium, and a low dose. Like I said, you walk in, you walk out. It just kind of takes the edge off.
Right.
The other one would actually be to use nitrous oxide.
Now that's laughing gas?
Laughing gas, and lots of people really do real well with laughing gas. It's ironic, in our practice I have a partner who uses laughing gas a lot, and I'm not really into laughing gas. I want to be someone that just have a small amount of Xanax or Valium because it just keeps them calm. Something that may seem a little simple is when you have the nitrous oxide on your nose and your mouth's closed, you do great. When you open your mouth, sometimes you don't do as well because now you're not taking in the nitrous as much. Hard to keep your mouth open and breathe through your nose for some people.
Wow. Now, sometimes when I went in, I've had to have a shot in my gums.
Right.
Is there any way to take the pain out of that?
Well, we use topical anesthetics, which I call fuzzy stuff, to put on your gum, kind of calm that down. It makes the tissue numb before you start. Also, we use a product, and I can't even remember what it's called now. It's a pump where it pumps the anesthetic in very slow, and you use a very small needle, a 30 gauge needle, which is very, very small, and that helps a lot. Also, certain dentists just have great technique. My partner, Jay Lambert's just really great giving shots.
Now, one of the things I noticed when I went in once, the water, you know, they put that water in my mouth, it's cold, it hits my gum, and I go, woo, gets a nerve going. Is there anything I can tell them to do so that doesn't happen?
Well,
I almost jumped out of the seat one time.
You know, I think part of that is tell them that you've got sensitive teeth.
Okay.
And then we should alter our treatment so that we aren't doing that to you. That's just very simple to say because there's lots of little gimmicks that we can do to not do that to you. And we have products that are like a product called Orachix. Orachix actually numbs you without using a shot. So if you had to have your teeth deep cleaned in our office, the first thing we'd use is that product.
Okay. Well, we've talked about a lot of different things here today. We've talked about the importance of keeping the teeth and gum clean. We've looked at a lot of products. We've talked a little bit about why we had all this happen. And if you had to leave one or two real tips with our viewers today that you really wanted to stress to them, what would they be, Dr. Swords?
Number one, go to the dentist.
Okay.
Get your teeth cleaned twice a year if you can do it. Number two, try to get rid of the bacteria in your mouth by using whatever products and methods you can. Okay. That's toothbrushes, flosses, irrigators, tongue cleaners, and pick the toothpaste you like so that you will use it longer.
Wow. Now, it's a shame in this well-marketed world that we have to go to these extremes to keep care of what God gave us way back at the beginning.
Right.
And we've noticed that any type of stress on the system, whether it be stress from extra weight or stress from medicines or stress from poor dentition, all causes this disease process. And sooner or later, they need the need for modern medicine. So I think what you shared with us has just been very, very valuable. We've learned a lot today about the importance of taking care of your teeth, and I didn't realize all the neat things you can do to help prevent this bacteria infection from getting in your teeth. Next week, Dr. Swords is going to be back and he's going to answer our specific question when it comes to dental care on Heart of Health. Please join us for that program.